We're back now with Dr. Darien, and we have a question for the ER doctor right here. Have you ever wondered if you've got vertigo and you're not sure what to do about it? Dr. Darien, help us out.
So vertigo versus dizziness. Just in short, dizziness is the feeling of feeling like you're going to faint. It might be feeling unsteady. Vertigo is when the room is truly spinning. If you've ever had it, you know exactly what I'm talking about. An estimated 40% of Americans will experience vertigo at one point in their life. So just to nerd out and get into it, what causes it? Many people don't know, but we have small crystals in our inner ear that help us regulate balance on Earth. When those crystals malfunction, that makes us feel off balance and can create a feeling like the room is spinning. That can be a side effect of migraines, that can be a side effect of diabetes, especially if it's untreated, or head trauma, or it can just come out of the blue, just in random. And so how do you treat it? There are a couple of things that you can do. Number one, avoiding the triggers, taking medications. There are prescriptions available, and there's also maneuvers that we can do in neurology offices. These are specialists that deal with the brain to help patients get back to normal.
Can we go back to the crystals?
Yes.
Because I'm like, are they like, the kind that you put on your table, like for good energy?
Very, very tiny crystals that we'll never be able to truly see because getting in that part of the body is very difficult. But many people don't realize they're in our middle ear. And one of the reasons why when you have an ear infection or a cold, why you might feel very dizzy.
Wow. Yeah. So what do you do if you think you have it?
If you have it, you have to talk to a doctor. Number one, because you want to make sure it's just vertigo and not something else. And then getting the treatment is really helpful. That can include physical therapy with people like vestibular neurologists. These are people who focus on this area of the brain, and also physical therapists that focus on this condition.
Well, so it just knocks your balance off or your equilibrium?
Sometimes it can last for a few hours. Sometimes it can be progressive. It can last for days, and it can come back and forth. And so it's really important to get examined and evaluated.
Sorry, I'm stuck on the crystals in our heads.